Welcome to the Eye Clinic. This video is about what you can expect in your comprehensive eye exam.
When you come in for your eye exam, there's information that we're going to gather. We're going to, of course, get your basic insurance information. We're going to also get a good health history, because things that can affect you systemically can also affect your eyes. So it's very important that we know the conditions that you have and the medications that you're taking. We begin every eye exam by assessing your visual acuity, which basically means, well, how well can you see? Of course, check the front of the eye and check the back of the eye. We're checking for any problems with your cornea. There are some serious conditions that can affect the cornea, such as keratoconus. There's some milder conditions such as dry eye that can affect the cornea also. Our typical eye exam can take anywhere from 30 minutes, but can take up to an hour if there are problems or maybe we're seeing you for the first time. I have examined anywhere from 0 to 3-month-olds. The American Academy of Optometry recommends that by age 6 months that a child have their eyes checked. Even at very young ages, children are learning shapes and colors. They begin to learn letters. Any eye problem can affect this developmental process, so it is very important to begin early with your eye exams. In elementary school, the print in books that you're reading, the font begins to get much smaller. And so that's another critical point in vision, because again, the learning can be affected. Dry eyes are very common, especially with the use of screens. We just tend to not blink as much as we should. We kind of zone out. This is another key element of the eye exam that I address. There are medical steps we can take to treat those dry eyes. Focusing issues are very common too with our near work. Our world is becoming increasingly more near as technology develops. And so this is important to have your focusing system checked. Often simply taking breaks from some of your near work. Our common thing that I tell patients is, follow the 20-20 rule. For every 20 minutes of near work, take 20 seconds just to look far away and focus on something in the distance. Another key component of the eye exam is that we check for cataracts that can develop later in life. We also check for eye diseases such as macular degeneration. And this is very commonly caught on a routine eye exam. Again, this is another reason why annual eye exams are important, because we can do a lot of prevention when we catch things early to keep vision loss from occurring. One of the main ones that I see very routinely is diabetes. We at our practice do lots of diabetic eye exams because diabetes is a disease that affects the small blood vessels. And so I am checking those blood vessels. I'm making sure that there's not any diabetic damage. This is called diabetic retinopathy because diabetic damage can cause vision loss also. But again, if it's caught early, there are treatments that can be done to prevent vision loss.